Hi, this is Dr. Eric Winder. Today I'm going to show you what I consider to be the simplest, best method for encouraging diaphragm breathing instead of chest breathing. Chest breathing is a very common problem now in our culture because, number one, a lot of people are sitting all the time, and when they sit, we're compressing the front of our abdomen, creating some pressure, and it's just sometimes easier to chest breathe. And some people chest breathe because of stress. Stress tends to cause us to be more rigid down around the abdomen and the diaphragm, and so we more easily breathe up here. And sometimes it's because of injuries or other factors. But regardless, chest breathing is not a good thing, at least not on a regular basis. So normally, we should be just average day-to-day breathing. We should be expanding down in the lower rib cage and breathing from here, diaphragm breathing, as the diaphragm muscle pushes down and then we expand our rib cage. And that is good because the bulk of our lung tissue is in the lower part of the lungs, and that's where we get the best oxygenation. Also, the lower part of the lungs have more blood vessels. The upper part is smaller, fewer blood vessels. We get a lot less oxygenation up here. And so if you're a chest breather and you breathe up in your chest all the time, then you're oxygenating less efficiently. You tend to take more breaths per minute because you have to breathe more in order to get your oxygen. And also you tend to blow off your carbon dioxide because of the more rapid breathing. And that promotes stress, it promotes higher blood pressure. And also just the muscle activity of chest breathing tends to trigger the sympathetic nervous system, which promotes stress responses. And so anywhere from 30 to maybe even as many as 50% of people out there on the street today in America are chest breathers. You can check this out yourself by putting one hand down on your belly, the other one up on your chest, and just breathe maybe a little deeper than normal. And watch what happens to your hands. And I'm going to exaggerate here a little bit, okay? A chest breather is going to see their upper hand rise and fall. If you're breathing well down into the diaphragm, the lower rib cage, the upper hand doesn't move much and you see the lower hand move. Now, I'm exaggerating because this is a video, but with good diaphragm breathing, it's really not your belly just expanding out like this. It's actually expanding all the way around the bottom of the ribs. So you actually are expanding in sideways from the bottom of your rib cage. And so if you watch, I'm going to exaggerate again here. So if I breathe out, you see my bottom rib cage expanded and then contracted again. And that's also part of normal. And also, there's a little bit of motion into the back. In fact, the back bottom of the lung is actually the largest part of the lung, and that's where you really want to breathe into. And that's what we're going to do right now with this exercise. I want you to take your hands and put them right back here on your lower back. And this position is wonderful because it does two things. Number one, the position of your shoulders being pulled behind you makes it very difficult to chest breathe. And at the same time, the position makes it easier to expand down in your lower rib cage and use your diaphragm. And when you breathe in, you want to try to feel your lower rib cage, the back of your rib cage, kind of pushing a little bit into your hands. And when you do this, there's one more aspect that is important here, and that is how long you breathe in and breathe out. And I'm going to recommend that you breathe out 2 to 3 seconds longer than your breath in. So for example, if you do a 4-second in breath, you breathe out for 6 or 7 seconds. Now the reason you want to blow out a little longer than you are breathing in is because that helps you not to get rid of too much carbon dioxide too fast, which is one of the things that produces the stress response from chest breathing. Chest breathers tend to actually breathe out faster than they breathe in. In this exercise, we're flipping that so that we're breathing out longer. It helps us hold on to a little more carbon dioxide which helps to calm down the sympathetic nervous system, and it can, in some cases, it can help reduce blood pressure. I actually had a patient who lowered her blood pressure without medication just by retraining herself to breathe properly. So we want that extra effect. So you're going to be, again, putting your hands back behind you, long breath in, longer breath out. Do this for 1 to 2 minutes at a time at first. When you're not used to diaphragm breathing, the increased oxygenation can make you a little lightheaded, and also you might be breathing a little more deeper than normal. And so you just do this a little bit at a time at first, but if you do it periodically through the day, every day, you can start to retrain yourself and learn how it feels to breathe properly. And when you start to stress out, or you've been sitting too long and you realize that you're breathing in your chest again, and you become more conscious of that, you can learn to more rapidly switch. And also at the same time be aware when you stop breathing properly. Give diaphragm breathing a try. If you're a chest breather, it's highly recommendable to learn how to breathe down into your diaphragm. Right now, with the COVID-19 coronavirus situation, there are a number of reasons to want to be a diaphragm breather. Number one, stress responses. If you are a diaphragm breather, you're going to have less activation of your sympathetic nervous system. You're going to handle stress better. You're going to be better oxygenated. Number two, there is a lot of suggestion in the research that chest breathing, blowing off extra CO2 and inducing stress responses, actually suppresses immune function, and that's not a good thing when we don't want to be getting a coronavirus infection. And finally, if you happen to have a lung infection like coronavirus, breathing well and breathing in your diaphragm can make a big difference in the severity of your symptoms and how good your oxygenation is. This exercise could be a good start. If you have the shortness of breath with that type of infection, you may want to look at other YouTube videos that go more in depth into aspects of breathing and related to having that type of infection, and also, of course, see a healthcare practitioner who is qualified to help you with a coronavirus infection. I hope you find this information useful and give it a try. Take care.